Maternal SARS CoV-2 disease engraves safe reaction in the newborn. Pregnant ladies have a higher danger of creating extreme COVID sickness COVID-19, on the off chance that they are contaminated by the serious intense respiratory condition COVID-2, SARS CoV-2. The impact on the baby, nonetheless, is less clear. Another bioRxiv * preprint research paper reports the immunological effect in the infant had by maternal contamination with SARS-CoV-2 during pregnancy. The maternal disease was found to incite irritation, which brought about cytokine creation and expanded usefulness of safe cells in the youngster. Study. The tradition of maternal SARS-CoV-2 disease on the immunology of the youngster. Picture credit. Prostock Studio/Shutterstock.com. Foundation. A previous examination from similar gathering of specialists affirmed that the advancement of the fetal invulnerable framework is affected by the presence of irritation close to the hour of conveyance. This sort of engraving has additionally been depicted during maternal human immunodeficiency infection, HIV, or hepatitis C infection, HCV, disease, regardless of the presence of fetal contamination. The fetal-resistant framework is directed by synthetic substances delivered by microorganisms and different organisms in the mother's gut. A few illnesses which show later in the youngster's life have been followed back to these sorts of early irresistible openings. Study point. The current investigation intended to dissect cell insusceptibility, cytokines, and neutralizer titers in children brought into the world to moms with a background marked by openness to SARS-CoV-2 during pregnancy. This information was then contrasted with that of newborn children brought into the world to unexposed ladies. Neonatal contamination with SARS-CoV-2 is uncommon, in any event, when the moms were tainted close to the hour of conveyance. Newborn children brought into the world to moms with SARS-CoV-2 contamination inside about 14 days of birth didn't have explicit immunoglobulin M, IgM, against any popular antigen in the rope blood, which was like the babies whose moms were tainted before this period. In any case, Ig antibodies explicit to the spike protein of the infection, the receptor restricting area, RBD, of the spike protein, just as the nucleoprotein, were found in the line blood. Line blood immunizer levels. Maternal and baby Ig levels coordinated against these antigens were practically identical in the recuperated bunch, which was characterized as moms who were tainted over about 14 days before labor. Nonetheless, the Ig levels were discovered to be lower in the line blood of infants brought into the world to moms with a later contamination. The exchange proportion, which addresses the proportion of the immune response in rope blood when contrasted with that which is available in the maternal serum, found the middle value of over each of the three antigens, was a little more than 1 in the recuperated bunch. Similarly, the exchange proportion was accounted for to be 0.79 in the gathering with later or progressing contaminations. All in all, the significant degrees of maternal Ig were not reflected in the line blood. Cytokine levels. Plasma cytokine levels were high in moms with later or current contamination, just as in their babies. These included interferon gamma-instigated protein 10, IP10, and interleukin, IL-1 beta in the mother. In the youngster, IL-10 and CXCL8 were available at more elevated levels. However, IP10 was decreased, autonomous of maternal IP10 levels. CXCL8, which is a chemokine firmly identified with maternal IL-1 beta, is ordinarily brought up in maternal SARS-CoV-2 contamination. In this examination, the degrees of CXCL8 were higher in the baby than in the mother on the off chance that she had been tainted inside about 14 days of conveyance, however not with prior contaminations. This reflects prior discoveries in babies brought into the world to moms with HIV, bunch B streptococci, GBS, and chorioamnionitis. CXCL8 levels were marginally brought up in moms tainted over about 14 days before conveyance, maybe because of the cytokine rise seen in vaginal conveyance. Notwithstanding, the critical rises of this chemokine in children brought into the world by cesarean area to as of late contaminated moms seem to demonstrate that diseases in the mother straightforwardly influence the safe reaction in the baby. Invulnerable cell profile. Exploration proposes Pfizer-BioNTech COVID-19 immunization reconstructs inborn resistant reactions. Metformin intensely hinders SARS-CoV-2 incited cytokine discharge in monocytes. Nanobodies from nanomice and llamas show intense killing action against SARS-CoV-2 variations. Versatile insusceptible cells showed wandering profiles in babies in this examination when contrasted with newborn children of uninfected moms, consequently demonstrating a fetal reaction to late disease in the mother. Lymphocyte checks stayed ordinary, as did the overall quantities of CD4+ and CD8+ T cells, B cells, and grand T cells. Prominently, there was an expansion in the extent of CD161+, CD8+ T cells, just as the T administrative cells communicating FOXP3. FOXP3+ tregs are corresponded with V delta 2 T cells, which are essential for the inborn safe cell reaction alongside normal executioner, NK, and NKT cells. An ascent in each of the three cell types, just as elective monocytes, was accounted for, with a decrease in CD38+ old-style monocytes. The later the contamination, the higher the small part of NK cells. Initiated NK and NKT cells were likewise more regular when CXCL8 levels inside the line blood were high. Taken together, these discoveries show a fetal reaction to the aggravation actuated by contamination in the mother. Be that as it may, aggravation appears to assume a defensive part in youngsters, as opposed to the harm it causes in grown-up SARS-CoV-2 contamination. Invulnerable cell usefulness. Favorable to incendiary cytokine creation from animated insusceptible cells was more noteworthy in both intrinsic and versatile cells from these infants. This included cytokines, for example, tumor rot factor alpha, TNF-alpha, IL-17, and interferon gamma, IFN-gamma. Expanded cytokine creation by CD4+ T cells was likewise connected with an ascent in the quantity of effector memory CD4+ T cells. Then again, expansions in the CD4+ and CD8+ T cells creating TNF-alpha were joined by a diminished articulation of CD38, which is a development marker. Maternal disease may have likewise delivered epigenetic changes in the qualities identified with these safe loci. Picture credit. Katerina Kahn/Shutterstock.com. What are the ramifications? The current examination affirms the exchange of defensive antibodies from the presented moms to the embryo. With a new or progressing disease, line blood explicit Ig levels were lower when contrasted with the levels estimated in maternal serum, in any event, when the last contained significant levels of these antibodies. Inoculation has been seen to be related with the placental exchange. Be that as it may, MOVE proportions were lower in the third trimester. This may halfway record for the lower levels in rope blood recorded in this examination, expecting that immunization-evoked antibodies are like those inspired by normal contamination. This may demonstrate that the subsequent trimester is a superior opportunity to give immunization to pregnant moms if the subsequent resistance is to be moved to the baby. Line blood cytokine height proposes that placental invulnerable enactment was happening. The three markers IP10, IL-6, and IL-10 are found in serious sickness in grown-ups, with the last two biomarkers frequently being utilized to anticipate infection seriousness in youngsters also. In youngsters, in any case, IL-10 is all the more frequently raised after maternal contamination. Almost certainly, maternal SARS-CoV-2 contamination decides neonatal immunology by making preparations framework in utero, contingent upon the hour of openness. Both brief cytokine creation because of aggravation, just as changes in safe cell usefulness, are found in these children. Taken together, these discoveries demonstrate that the invulnerable arrangement of these children is engraved by this openness, which could impact the insusceptible development of the baby in the long haul. More subsequent will be needed to see such sequelae. In the interim, second trimester immunization has all the earmarks of being the best chance for pregnant ladies to streamline immunizer move to the baby. There stays a need to dissect the safe profile in the youngster after immunization against SARS-CoV-2 to decide the necessary degree of enactment of the maternal insusceptible reaction for such engraving to happen. Important notice. BioArchive distributes fundamental logical reports that are not peer-inspected and, in this manner, ought not be viewed as definitive, guide clinical practice, well-being related conduct, or treated as set-up data.